We've had a very rough 3-4 weeks or so. Definitely the week of the 4th of July it was our high water mark in terms of the sheer number of cases. What I can also tell you, though, is that subsequent, we have been slowly going down since that time. I believe that in large measure, it is a result of the June 19th action of the board to require universal mask usage. I really think that that has been the main driver for why we've been able to see the downside of this trend.
If we are on the mend, the numbers are on the trend, headed downward, people are wearing masks, why can't students return to schools?
Well, that's a complicated thing, right? So when we're talking about especially young kids, we are still at a level where our positivity, that is the number of tests that are coming back positive, is in excess of approximately 9%. By the way, it was as high as 19% right before the 4th of July. You want that positivity rate to be less than 5% before you could say things in a community are relatively stable. Things in the community are safe enough to bring children and other people back out of some of the mitigation strategies. So even though I think we're headed in the right direction, I by no means would claim victory yet. And I still believe that we have a couple months to get to that positivity rate of less than 5%.
But what should parents be looking out for as they start to make those decisions about school districts potentially reopening?
So I think one of the most important things that parents need to do is to think about the fact that whereas before there was some wiggle room in terms of, oh, my kid has a cough, but I'm going to send him to school anyway. There is absolutely no wiggle room for sending a sick kid to school. Zero. Remember that schools are places where we have a lot of kids, including some children who are medically fragile. That's the other thing that drove our decision to take a stand on this issue. Putting those children back into a regular classroom environment who are medically fragile, I think would be potentially dangerous.
What criteria will you be looking at before you give school districts the green light?
Well, if you'll recall, back early on, we sort of published 9 different criteria. And those criteria have served us well and have been really good indicators of how this community is doing. Right now, 6 of those criteria are in the red zone.
Dr. Garcia, you've been working on this since January 26th, you told me, where you really took part of being a member of task force. Looking back, and I realize hindsight is 2020, what do you wish you would have done differently here in Pima County to stop this spread?
I mean, that's a hard question because I frequently ask myself, what can we be doing differently? We activated our Emergency Operations Command very quickly. We mobilized our hospital partners very quickly. We engaged our school district partners very quickly, our ambulatory care sector. I think our biggest deficiency is the same deficiency that is being felt across the country. And that is the testing capacity was completely inadequate and was never designed to meet the challenge that we were confronting. And it has put us in the position of having to compete with other counties and with the state itself and even with other states for precious limited testing resources. And now our new issue is test turnaround time. As the tests become more and more available, labs are running into capacity issues, running these tests through their system. And so those continue to be the things I lose sleep over.
I think many people are looking for, when do we get some sense of normalcy back in our lives?
And I think that's a challenge, right? Because all of us are exhausted. I'm exhausted. All of us are exhausted about being at home, being cooped up. All of us are starting to get a little frayed. And I guess the case that I would make is, if we don't stick to this a little bit longer, I don't see a positive end in sight. If we can make this stick, for another 4 to 8 weeks, I believe that we can be in the recovery territory.
Okay, that sounds like good news to me. Thanks, Dr. Garcia.
Thank you, Lorraine.